mental health and the surgical outcome, how are they related? So researchers have consistently showed that people with mental health issues like depression, anxiety are linked to higher pain scores. You see the post-operative pain scores are higher in patients with depressions. And poor mental health predicts a slower recovery. And psychological distresses increase the risk of chronic post-surgical pain. Positive coping mechanisms are lost in these patients, and you can see that in spite of doing one of the best surgeries in these patients, the outcomes are always poorer because of poor pain managements. So what do we do about people with mental health issues or little anxious patients? How can we help them with? So one is, there is something called as screening and assessment protocols. So many orthopedic teams now screen for one, depression, anxiety, pain catastrophization, substance abuse. So important for pain management post-operatively. So early identification allows for prehabilitation. That means even before the surgery, we can prehabilitate by adjusting their medications, making their anxiety levels little less, and not just a physical rehabilitation. So the strategies to support mental health are: one, before the surgery, clear education about the procedure. So patient should have a proper knowledge about the surgical procedure and recovery timeline. So giving a proper timeline is very important. There's something called cognitive behavioral therapy, CBT, or brief counseling about the surgery and its complications. And then mindfulness or relaxation techniques, which usually is performed with yoga therapies and yoga practices.